Hastings Street has two programs. One is the Hastings A program, which has a majority of women who have been diagnosed with Alzheimer's. All of the women in that program have lived together for several years. And then the Lower Hastings program is a new program that was created to provide services to 3 women who have pervasive developmental disorders. We're new to supporting people with Alzheimer's, and one of the things that we've learned as we've seen the progression of the disease in each of the women is that even though there are similarities in terms of how the disease affects their cognitive functioning, their personalities stay the same. They're just as unique as the disease progresses as they were prior to the diagnosis. You know, we have a woman who is now in the latter stages of Alzheimer's, but continues to retain her sense of humor. This was something that was there, that was a part of her personality before the disease ever took hold. I think that one of the strengths of United Arc is that it's sort of in the air that we breathe that we're going to treat people as individuals, not as diagnostic labels, not assuming that people with intellectual disabilities are all the same and that there's a sort of packaged program that works for everyone.
What's today?
Wednesday.
And then what?
Thursday, Friday, Saturday.
We have 3 women who are autistic who live here, and they vary from ages of 22 to 35. The women here often have high anxiety or some self-abusive behaviors, and I would say those tend to be the most challenging.
With the menu later.
Evelyn, how was your day today?
Good. I want my mom. I called my mom.
We have several tools that we use. We have a lot of sensory things, which include things like oral chews, stuffed animals. We take a lot of walks. Some women go for rides. There's a lot of therapeutic things that we've learned from our clinical director that help them during their challenging times. The happier moments are when you can see progress in an individual. When you've worked with an individual for a period of time, and when you first started working with them, say they couldn't tie their own shoes, and now they can tie their own shoes, or they've learned how to self-soothe themselves during a time of anxiety, or they've learned how to interact in the community or interact with housemates or staff in a positive way. That's really fun, and it's really exciting to see. I think that they feel like the people who work here generally care about them, and they call it their home, and they've had a lot of input on colors of their rooms, what they want to hang on the walls. They do grocery shopping with staff. They help decorate during holidays. So I think for them it's their home.
It's like a safety thing for her.
Okay.
It doesn't even occur to the people, to the direct care staff, that somehow because someone has an intellectual disability or some mental health disorder that somehow that has taken away from their humanity.
Reason I'm happy about more.
I've worked with people who grew up in institutional settings in Belchertown in the state schools, and they come away with a lot of baggage and a lot of mental health needs that I think wouldn't exist if they had been allowed to live in an environment where they were able to develop their own interests, have some sense of control over their lives. That's what small community-based programs are able to provide.